Doctors of Reddit, what was your dumbest r/I am very smart patient experience? RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 lbs, diabetic, heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in, he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams, "No who? No water. He's allergic to water." Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at a hospital with him. You can't make this shit up. I work in the ER. We had a very pregnant patient come in needing stitches in her vagina. Turns out she was a realtor and didn't want her water to break while she was showing a house, so she put a glass cup in her pants to catch the water. Instead of using a pad or an adult diaper, she went for a glass cup. She sat down while showing a house and sure enough, it broke and cut her up pretty bad. Was working at a clinic. I was speaking with a non-controlled diabetic patient about her sugar intake, and she said she drinks a 32 Oz soda every day. I ask her if it's regular or diet, and she replies with it's half regular. I let the ice melt first, so there isn't as much sugar in it. Sorry, but that isn't how it works. I had a patient who was a completely non-compliant diabetic, smoker, morbidly, who had his first heart attack at 45. His blood pressure was also super high. And instead of taking his antihypertensive medications, he went to the gym. In the gym, he would sit in the sauna for a very long time and sweat a lot and lower his blood pressure by becoming dehydrated. I have one. I got this from my friend, who is a doctor on the children's ward in a rural hospital. These parents bring in their child whose hair is infested with lice. The lice was visible to the naked eye and could be seen crawling on the child's clothing. While the medical staff examined the child in order to determine a course of action, they discovered the child was covered in a white powder and smelled heavily of chemicals. They asked the parents what were the substances and the smells emanating from the child. The parents said, quite matter of fact, it was 7 powder and flea and tick spray they used on their dogs on the family's farm. Needless to say, social workers were notified about this case. 70-year female tripped and fell 2 days ago. She came it with hip pain, but reports after the fall her nose was bleeding. She had landed on her nose. About a year prior, her dentist had messes up an infraorbital nerve block and caused some swelling in that region, but that all was resolved. This old lady is now convinced her nosebleed after falling on her face is related to an infection from the dental issue a year ago. After multiple back and forth on the etiology of the nosebleed, she became the first patient I raised my voice and put down an authoritative "No, you are wrong, just stop it." Patient had a hard time getting pregnant. Finally conceived, but miscarried. Patient has a D&C so she can try again, this time with medical intervention. We monitor her blood to ensure the pregnancy hormone is gone before beginning treatment. But she keeps coming back with high levels of hormone. Docs are worried because she might have some retained placenta or pituitary disorder, and this could be super bad for future fertility. We call her in for a conversation about the hormone levels not going away. After talking together about what might be wrong, they are going to go home and think about further tests. She says I need to go. I have an appointment at the weight loss center for an HCG shot. Turns out that she is on the HCG diet. HCG is the pregnancy hormone. And this was after an hour of the doc saying, "We don't know why you have these constant high levels of HCG in your blood, and we are worried." I'm a courseman, not a doctor, but I once had a patient tell me that there was no credible research that smoking was bad for one's health, okay? 80 plus Y. Oh, patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all, DW. At some point, you kind of have to stop being polite and just tell patients/family members bluntly that you don't have time for this shit and what you recommend, and they can do what they want and just document everything. It happens a lot, but she sticks out. Oh yes, we had an elderly woman with severe malnutrition, and her hippie daughter wanted us to only give her raw, unpasteurized goat's milk. We did everything we could to convince her that her mother wasn't getting enough nutrition. We even tried to allow her to bring in the raw, unpasteurized goat's milk that we would supplement with the FDA-approved formula we wanted to give her mother through the feeding tube. We finally had to become pretty blunt with the daughter and let her know that her mother was going to die due to malnutrition due to the daughter's unique views on what was a proper diet for her mother. I am a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal?" "No, I need you to move your head right." "Hey doc, are these cavities being caused by the anaerobic pathology microbes?" "No, they are caused by you eating snacks all day and not brushing." Not my story, rather my colleagues. A patient was admitted for anemia and a localized cancer was found. She was referred to surgery so she can get cured from her localized cancer, and she started telling everyone that it was the doctors who caused the cancer and that she was doing just fine before coming to the hospital. She lectured the surgeon and my colleague, who pleaded her to get her surgery so that the cancer doesn't advance, and yet she refused, saying she knew better and probably didn't even have cancer. I didn't treat this patient, but I was on shift when this guy came in with tombstones on his EKG in the setting of chest pain. He told the ED doc, "I want a second opinion before going to the cath lab. This EKG is unmistakable." The interventionalist had to come down to the emergency department to tell him he was having a heart attack. Was working at pediatric urgent care. Family brings in their 3-year-old unvaccinated son with autism for a weird rash. They couldn't give me any reason why when I asked them about his vaccination status. Maybe they're worried about super autism? Nurse here. The number of American 20-something males who don't know what circumcision is ridiculously high. They think that boys are born circumcised. Evidence, new fathers and mothers asking me what's wrong with their newborn son's penis. He still has his foreskin. Many parents choose to have it removed when the baby is a couple days old. It's called circumcision. Often followed by a parent's question, "What's circumcision?" That's when I face palm. Not a doctor, but I'm a medical technologist. There are plenty of I am very smart moments, but this one was recent. Did a finger stick for a patient, ensured the little cut stopped bleeding, and then put a Band-Aid on it. Told her to collect a urine sample for testing. Test came back strongly positive, 4+ reading for blood. She complained to the doctor that there is NOWAY, she has blood in her urine, and that the blood from her fingerstick must have entered the urine, throwing off her reading. She said it was my fault that I did her blood test before her urine test, and I obviously made a mistake. She repeated the test later in the afternoon, still at 4+. Came back a week later, still at 4+. The look on her face when I told her, "Sorry, ma'am, your result is still positive," was priceless. So the patient had low blood pressure, so their self-treatment, eating more fatty foods in order to decrease the size of their blood vessels in order to increase the blood pressure within their system. Why? That's just crazy enough to work. Plus, if they do it long enough, they won't even have to worry about their BP anymore. Not a doctor, but a patient whose mother was like this. The doctor had to speak to me on the side because of it. My grandmother has Crohn's disease. Very, very badly. It skipped my mother and her brother. When I was 15, over the course of 6 months, I went from being 5'9" and 190 pounds to being 110. I was a skeleton, extremely anemic, and coughing up blood. My mother was convinced it was something else. I forced her to bring me to a doctor, and she spouted off all these possibilities. She then talked about what she Yahooed, not even Googled. Yahoo, about genetics and such. And Crohn's can't skip generations. Well, the doc said, just in case, we're gonna run some tests. Long story short, I have Crohn's in my throat and small intestine. So does my cousin. It just skipped a generation. Just got this story from my girlfriend's stepdad, who is a neurosurgeon. He had an OB/GYN friend who had a couple who couldn't get pregnant. Apparently, they had been raised in some religious fundamentalist cult and didn't understand how sex worked. The guy was just rubbing his penis against her leg and ejaculating on her thigh. I think this sort of thing is way more common than we think. My mother is a gynecologist and had a woman come in to talk about possible infertility. She was 18 years old and had had sex with her husband a single time and didn't get pregnant. So she was upset and scared and demanded tests and all sorts of things. She had been taught nothing more than sex equals procreation, to the extent that she thought every incident of sex equals one baby, and presumably couples who had 3 kids had only had sex 3 times. So my mom had to give this married woman a sex ed lesson. I used to believe that when I was like 12. Then I caught my parents going at it and got scared I'd have another brother. Mom promptly explained that that won't happen. I was relieved and felt like I understood sex. And then Mom told me she was pregnant. Thank you for watching. Don't forget subscribe and watch our next videos. Bye.